Okay, it's my pleasure in this series on what I'm titling Reflections from Pharmacy Leaders and Advancing the Profession to welcome here Dr. William Evans with us. He's a member of the St. Jude's faculty and endowed chair in pharmacogenomics. He previously served as the CEO of St. Jude's Children's Research Hospital down in Memphis, Tennessee, and is also a professor and endowed chair at the University of Tennessee. Dr. Evans really has won and been recognized for his research, clinical translational research over his career. He received the Paul Parker Medal from ACCP. He received the Remington Honor Medal from APHA and was also recognized with the Vollweiler Research Achievement Award from AACP. And also significant, he was elected to the IOM, the Institute of Medicine of the National Academy of Science. He's really a pioneer and a leader in pharmacodynamics and pharmacogenomics of anti-cancer agents, especially in children. And I really wanted Dr. Evans to participate in these interviews because he has a legacy, and obviously it's significant. In some years ago, his sort of breakthrough research looking at the pharmacodynamics of high-dose methotrexate and ALL in children, which was published in New England Journal of Medicine. That was a significant breakthrough for clinical translational research in terms of contribution by the pharmacy profession. So I'm going to stop sharing. And thank you and welcome. I'll call you Bill, but Dr. Evans.
Sure, please.
Well, what I want to start off with is maybe we want to learn more about your journey in your career, to your career and recognition as a leader, maybe key events or people who have influenced you in that journey.
Yeah, well, my journey in pharmacy began when I turned 16 and I got a driver's license, and then I could work in Warren's Apothecary as a delivery boy. My parents were good friends with Charlie Warren, and I had not been thinking about pharmacy school, but after working with him for a few years and seeing the impact he was having on patients and the fact that he was being very successful in his life and in his profession, and with his encouragement, I decided to pursue pharmacy school. Now, that was back in the day at Warren's Apothecary. We would fill 50 or 60 prescriptions a day. But Charlie provided a lot of service to the patients who came in. Over-the-counter meds weren't very many in those days. Benadryl was still a prescription drug, for example. But he also had a suite of doctor's offices behind his apothecary, and he did a lot of consulting with them. So I was sort of seeing clinical pharmacy in the 1960s, 1968, before it was called that, but I liked it. And of course, his model was not to sell the cheapest prescriptions in town, rather it was to provide the best service, and people were willing to pay a little more money for their prescriptions to get that service, and I like that. So then I went off to pharmacy school, didn't work my first year. It was the first time I had never worked during school, and just wanted to see how good a student I could be, and that worked out. And then I worked for a little while in a chain drugstore, and instead of filling 60 prescriptions a day, we filled 300 or 400, and I said, well, this is not for me. And then a job came open for a student pharmacist at St. Jude Children's Research Hospital. I took that position in 1972. I still hadn't graduated from pharmacy school, and really got exposed to an extraordinary institution, to an extraordinary group of pharmacists who were practicing a different kind of pharmacy than I'd ever seen, very engaged in patient care and in research. And then I went to the PharmD program, so that was a post-BS program back in those days, and we had to do a research project to get our PharmD degree. And so I did my research project at St. Jude, and that did two things, I guess. One, it told me or taught me that I enjoyed doing research. And secondly, it introduced me more deeply to the research staff at St. Jude, because I was now collaborating with them. And that sort of put me on a hospital pharmacy / academic track. And when I finished my PharmD program, there wasn't a position available for me at St. Jude. So I told Larry Barker, the director of pharmacy, if he had anything come open to give me a call. And meanwhile, I took a faculty position at the University of Tennessee. And lucky for me, 18 months later, Larry Barker called me back and said, we've created a position. So I went to St. Jude January the 2nd, 1976, and have never left. And of course, it's been quite a journey. And people have asked me many times, how could you stay at the same place for 40 plus years? And I used to come up with various answers. And then after a few years, I realized I was giving the wrong answer. St. Jude was such an entrepreneurial place that every 7 to 10 years, it was redefining itself in terms of the nature of its programs, the people on campus. It was growing rapidly. So yeah, I had physically stayed in the same place, but I really had worked at several different places under the name of St. Jude over that now 42 or so years.
That's great. Thank you. Yeah, that's, I did not know that. So this is very good.
Yeah.
Your history of your journey. So this is, I believe, well, it should be an easy one. Your legacy in 20 years. You have a legacy now, and I think it's so rich. Our students will read about, you know, as the clinical science evolved in our profession, and there'll be a little, not a footnote, but there's someone called William Evans, and hearing from you. Well, you know, and sometimes I paraphrase this question to say, what are you most proud of in terms of your contributions that really help advance the profession?
Yeah, well, it's really been working with great people. And I have great colleagues here at St. Jude. When I was the CEO, people used to ask me, so what do you do every day? And I eventually realized the answer was, I try to do what I can to make St. Jude a place where great people can do their best work. And if we do that, that will create more progress and advance cure rates. So how do you do that? I mean, you create a culture of collaboration, of compassion, of really innovation, and at St. Jude of quality. And we're fortunate, and I had a board that gave me the resources to try and do things as well as they could be done in healthcare and in research. And so quality was always something that was on the priority list, as well as innovation and collaboration and compassion for our patients. So it's really been the people I've worked with through those collaborations. But I think, to your question, my legacy is going to be the people I've trained in my lab, who are still working and who are still training another generation 20 years from now. So, you know, I guess I have children who have finished their postdoctoral training with me and gone on to become successful faculty members, deans of colleges of pharmacy, directors of institutions, leaders of startup organizations. But they've gone on to create, you know, train further generation. So those are my grandchildren. And then those grandchildren are training more people now. So I've got great grandchildren. And I think my legacy is going to be the 100 or so people that came through my lab and went on and then trained another 100 and they trained another 200. You know, hopefully they've carried on in the sort of the overarching approaches we took as pharmacists doing research, which was we needed to contribute something unique to the team with our medical colleagues and our basic science colleagues. And that really was in this space of translational research, as you mentioned, where I think we were really well positioned. My education in pharmacology and therapeutics, coupled with the experience I got in really on-the-job training and doing research, allowed us to work in a laboratory, but we were always working on patient-related problems. And we were studying patient leukemia cells in the laboratory or patient DNA in the laboratory. And it was always connecting back to a patient problem. And every grant I ever wrote was started by a problem we saw in the clinic. That we needed to figure out, why was this drug toxic to 20% of children and not the other 80%? Or why did we cure 70% of kids and not the other 30, or now 90% and not the other 10? And so it's been some basic science involved, but it's always been connected back to the clinic. And I think that's really flows from my training as a clinician.
Mhm. Very good. Excellent. Thank you for that. So the next question has to do with advice for students in their journey as they develop as leaders. Um, some key
Yeah,
pearls.
right. And well, I have given a few commencement speeches now in this point in my career. And, one of the things I try to convey to the students and their family and friends in the audience is that pharmacy has provided you an incredible foundation to do, many different things in your profession and in your life.
Mhm.
And you're graduating, you're talented, you've accomplished something important, um, but don't set any hard and fast boundaries on what it is you're going to do in your career. And I give the example of, I had no idea, no goal of becoming CEO of St. Jude when I started working as a clinical pharmacist at St. Jude in 1976. Yet in 2004, my colleagues and the board asked me to become the chief executive. Now, I loved that job. It was a 10-year period of time where, we did many exciting things. But as I talk to the students, I say, look, I was running $1 billion a year organization, and yet I had never taken a business course in my college education. I'd never taken a finance course. I'd never taken a management course. Yet, I was well prepared to take on this leadership role because, a lot of it is common sense and a lot of it is surrounding yourself by talented people that are smarter than you are. And so I had a good CFO to manage the books, and I had, good people to run the operations side of the organization. And my job was to lead and to create a place where great people could do their best work. So my message to students is you cannot anticipate fully today what it is you're going to be given the opportunity to do 10, 20 years down the road. When that opportunity comes along, if it's something you think you want to do, be confident. Know that you've been prepared well uh, through your education and your experience, and go for it. That's basically, what I think so many of us have done. And there have been a few Remington medalists who've given, and I think Grover Bowles gave the talk back in the 70s when I was a student. He's also a fellow Tennessean who got the Remington. He said, too often pharmacists are reluctant to step forward and to take on these bigger sets of responsibilities. And we shouldn't be. We should be not only willing, but eager to do that when the opportunity presents itself. So I just tell the students, be confident.
Mhm. That's a very good words of advice. Thank you for that. So the last question. So when we're going to be studying the decade of the 2020s, we're going to mention one of the key event and probably I think a milestone in our profession and in the world will be this COVID-19 pandemic. How do you see that being an opportunity for the profession? Why will we say that's a turning point for our profession or a
Yeah,
significant event?
yeah. Well, I think I haven't really thought through these questions. I'm sorry. Maybe I should have had more packaged.
No, not at all.
Perhaps I'm rambling a bit, but I think as I've lived through this COVID-19, situation, pandemic, there are a couple of things. One is I believe public health will be a discipline that has greater value and recognition across all the professions,
Mhm.
and hopefully within our governments around the world, as to how we need to be better prepared for these kinds of outbreaks and pandemics, and what we need to be able to do as a society to deal with these situations. And I think public health is a discipline that's probably not gotten as much recognition. And now you're seeing the potential and the power of strong public health and being able to rapidly deploy testing and deploy contact tracing and to manage through physical distancing, trying to control a pandemic. And there'll be others probably in the future. I think on the pharmacy side of this is I think, put pharmacists even more clearly out there as a immediately accessible health professional in communities across the country, where the public can go for good advice on healthcare and hopefully good guidance on how to deal with the COVID-19 pandemic and avoiding becoming infected and avoiding infecting others, which is going to be the way out of this. And of course, vaccine eventually is going to be the solution to COVID-19. And I would hope that pharmacy is going to play a big role in that. And hopefully we can help educate the public, and this will give us an opportunity to do that vaccines are a good thing, because there's been so much misinformation about vaccines not being good that we're, have started seeing more measles and mumps and diseases that are readily preventable. But obviously this is going to be front and center on people's mind once we have a vaccine for COVID-19. And they have lived through this disruption of society and life as we knew it.
Mm-hmm. Absolutely. Absolutely. Well, I appreciate those insights. Those are definitely great insights. Thank you very much.